People say that they want to see AI cure cancer. Well, thanks to the Mayo Clinic, it's happening. Pancreatic cancer is one of the hardest cancers to detect early, and that's one of the reasons why it's so deadly. It's on track to become the second leading cause of cancer-related deaths in the United States by 2030. Right now, the 5-year survival rate for pancreatic cancer is 13%. But when it's detected early, confined to the pancreas, and treated accordingly, then the survival rate jumps to 44%, which is a massive difference. So the big question is, how do we find it earlier? And that's where the Mayo Clinic's work with artificial intelligence comes in. I'm Paige Lord, and this is my series AI for Good, where every Friday I tell you something good that's happening in the world of AI. One of the things that AI is really good at is evaluating things in images that are so small or complex that humans can't reliably identify them. Dr. Ganeka from the Mayo Clinic said, "We have seen that AI can help us diagnose pancreatic cancer almost a year before its clinical presentation." The AI system is called Radiomics-Based Early Detection Model, or REDMOD. The model was trained on nearly 2,000 CT scans, which included scans from patients who were later diagnosed with pancreatic cancer. But rather than evaluating pixels, which is a lot of what AI does, it extracted hundreds of quantitative features and measurements describing tissue texture and structure. Then they combined 3 classical machine learning algorithms: logistic regression, random forest, and extreme gradient boosting, through an ensemble voting system, and that created the final model. The important part is that those early scans had been interpreted as normal, but when REDMOD reviewed them, it identified 73% of those pre-diagnostic cancers at a median of about 16 months before diagnosis. That's nearly double the detection rate of specialists reviewing those scans without the assistance of AI. So by using this AI model, pancreatic cancer can actually be detected earlier in some cases. And that's why this breakthrough at the intersection of AI and medicine is really important. Because this isn't about replacing doctors with artificial intelligence, this is about doctors using artificial intelligence to detect things that they can't see. And this is especially important in diseases where early detection absolutely matters. The study also found that the model's predictions stayed stable over time. So in patients that had multiple scans, the AI produced consistent results months apart, which of course makes it useful for long-term monitoring and early intervention. Now, we're not at a place where this has been scaled out to doctors across the country. This still needs validation, it needs careful deployment, and it needs strong clinical oversight. But this is one of the clearest examples yet of where AI and medicine can have a meaningful impact and actually save lives.